Welcome to the Daily Dose of Derm podcast, your go-to podcast for all things dermatology. I'm Dr. Mohiba Tareen, a board-certified dermatologist and the founder of Tareen Dermatology. Join us as we dive into the fascinating world of skincare, beauty, dermatologic treatment, and how to enter the world of derm. Whether you're a skincare enthusiast or an aspiring medical professional, this podcast is your daily dose of knowledge and inspiration. Get ready to uncover the secrets to healthy skin and discover how to make a meaningful impact in the field.
Hey everyone, welcome back to another episode of the Daily Dose of Derm. I am your host, Shiab Adam. Today is a very special episode. I'm here with easily top 10, one of my favorite people in this clinic. She is the amazing Haley Rogers, one of our amazing physician assistants here at the clinic. Today's topic is going to be exploring skincare, treatment considerations, particularly during pregnancy. So we'll be covering everything generalized dermatological topics, conditions, things like that, specific restrictions to look out for, as well as safety measures to look out for while being pregnant. Haley, thank you so much for being here.
Thanks for having me.
Gosh,
Happy to be here.
Absolutely. I know how busy you are, but we really appreciate you taking your time. But just go ahead, kind of introduce yourself. What drew you to the field of dermatology to begin with?
Yeah, I'm a PA here, as Shihab so eloquently put it. I had experienced like a wide variety of dermatologic conditions myself when I was younger, all the way from TMI like cysts to acne, warts, and as I was kind of exploring what I wanted to do in as far as a PA and specialties, I kind of knew from the get-go that this is where I wanted to be.
Right.
I did something similar prior to PA school as Shihab did. I was a medical scribe in a derm clinic, and that kind of sold it for me overall. Yeah. And happy to be here.
There we go. Yeah. Where did you go to undergrad? Walk me through your education.
Yeah. I went to undergrad at Miami of Ohio University. Kind of random that I ended up there, but that's ended up where I ended up meeting my husband. So
there we go.
Fate led us there. And then I took a gap year. I was a sort of medical scribe in the ER and then eventually a dermatology clinic here in the Twin Cities. Got into PA school, went to Midwestern University in Downers Grove.
Yeah.
Along with half of the other PAs that I think are here.
Yeah.
There's quite literally like 6 or 7 of us that went to Midwestern, all different years, oddly enough. So that's pretty special.
I love that.
And then I worked in Chicago for quite a bit out of PA school. And then this opportunity presented itself to move back home and work at Tareen, and haven't looked back since.
Now, when you were in PA school, were you pretty targeted on pursuing dermatology? Were there other specialties you were considering at the time, you were liking during your rotations?
I think it's important, obviously, as we are biased because we've worked in derm before, to keep an open mind. So I did have an open mind, I would say, prior to starting in derm. But then, you got to learn the ropes of everything else. And you're like, nope. This is where I'm meant to be. Right. So I did work in surgery for a little bit too, to kind of test out the waters there. And I loved it. It was great. I think it's made me a more well-rounded PA for sure, just having those experiences. But I'm ultimately where I want to be.
There we go.
Yeah.
I love it. So you just had the most beautiful baby girl recently. Congratulations. Well, what was it like being pregnant?
It was wild.
So was it everything you expected and even more?
So I think I had like all my younger and a couple of my older sister-in-laws to look at and kind of see how things were going with them, because I was the last one to have a child. So I kind of knew what to expect, but you don't really know until it happens to you, truly. So
Were there any things for you that was like a regular thing, something you ate constantly, or something that you really needed to start staying away from once you realized you were pregnant and hey, this could be detrimental to me or the baby? Were there really any things right off the bat, like, hey, I gotta stop doing this?
Yeah, good question. I, along with many other patients, was on the holy grail topical medication, tretinoin.
Gotcha.
Tretinoin is not advised to be used during pregnancy. As you know, the oral form of tretinoin is Accutane. And so in theory, if you were to get pregnant on Accutane, it can cause birth defects of the fetus.
Gotcha.
So studies, nobody's actually going to do a study and look at babies in utero and women who are using tretinoin. We just know if you're taking systemically, it's not going to be great for the fetus, and you're going to have birth defects. So why risk using the topical version of it?
Yeah.
Because in theory, they say there could be some systemic absorption. Now, is that true, or does that actually translate to pregnancy and birth defects? Probably not, but it's one of those medications that's category C that you should not be using.
Gotcha. Did some of your acne like come back? Like some of the acne you were having back in the day? Like what other like dermatological conditions were you seeing that were arising now that you were pregnant?
I definitely had a couple of acne flares during my first trimester. Have you heard the old wives' tale that girls steal your glow and boys are supposed to give you
I have heard
back?
that.
Yes.
Yeah. Is that the...
Well, so we didn't know what we were having, so I was pretty convinced I was having a boy because I was having acne, or pretty convinced I was having a boy because then my skin went back to being glowy and normal. But at first I was like, maybe it's a girl because I was breaking out a little bit. So ultimately what ended up happening was I made a couple of adjustments in my topicals I was using. I switched to azelaic acid, which I'm a big fan of. Also helps with rosacea, which I struggle with. I noticed my rosacea flared a lot with pregnancy as well.
Is that common among most women when they become pregnant?
I would say so. You can tend to have a lot of fluctuations, especially like in the first and second trimesters as your body is adjusting. The other thing that can be pretty prominent is something called melasma. It actually is called the pregnancy mask, and it's basically hyperpigmentation on the face. Gotcha. We think it's due to like estrogen increases. So you can also get it if you are on exogenous estrogen, aka in the form of birth control. So sun exposure worsens that. So I had a little bit of that. So I was just obviously being hyper aware of my SPF. Tinted SPF actually helps a lot with that, or so, because it's offering a physical blocker as well.
So like azelaic acid, like you said before, is that a medication that is safe for women to use when they're pregnant? That's a pretty good alternative.
Yep. There's a couple of great alternatives, and I think it's important to, you know, open that line of communication with your dermatology provider if you are someone who's planning on becoming pregnant or are pregnant and your skin's fluctuating. Obviously there's things and adjustments we can make in the medications you're on. Azelaic acid is one of them. Metro cream's a pretty common medication we'll put patients on for acne or rosacea. There's some other tricks up our sleeve, I would say.
What about hair conditions? Are there any fluctuations between like hair growth with, you know, among women who are pregnant? Like I'm trying to think of all the different ways that pregnancy can be affecting you.
It
like
affects you a lot, of different ways. Hair is certainly one of them. Oddly enough, people tend to find that their hair gets a little bit more fuller, can get longer, stronger when you're pregnant because you're not having quite as much transition to those shed phases. And then, of course, comes the big telogen effluvium, if you've heard of this. What the big pregnancy shed usually happens after a big life stressor, i.e. that stressor is pregnancy of your child. And so it's around like month 3, 4, sometimes even 6 that you kind of get this huge transition to telogen phase where your hair starts to fall out. We notice thinning. It can be pretty alarming for women. Things that can be helpful are just knowing that, you know, kind of bearing it and grin and bearing it and getting through that transition phase and just knowing that it's going to be short-lived. Other things that can be helpful are like supplements like Viviscal. You know, continuing to take your prenatal vitamin has been shown to be helpful as well.
Yeah,
so
absolutely.
Vitamin D optimization too.
Do you know of any other possible conditions that women may not be fully aware of that may happen during pregnancy, dermatologically speaking?
Yeah, I mean, there's a couple of crazy rashes that can happen. PUPS is one of them. So it's pruritic, urticarial, papules, and plaques of pregnancy. It's like this intensely itchy rash. Usually is like on kind of the abdomen region. It's usually during like 3rd trimester.
Interesting. Okay.
The other thing, like we alluded to, melasma can happen. Stretch marks, obviously, can happen. Those are, you know, largely genetic. There's things we can do after sort of delivery to help minimize the appearance of them, but it is unfortunately sometimes
just comes with the gig.
One of those things that comes with the gig. Moisturizing and oils can be helpful as well during pregnancy. So
a lot of women may, you know, have a very, you know, structured skin routine, a bunch of washes, topicals, creams like that. Are there any particular ingredients that are in certain products that women should essentially need to stop using because it, you know, there's a risk to their pregnancy? Yeah.
I mean, like we alluded to before or talked about before, nobody's going to do a big study on
Right.
something that would be harmful to the fetus or harmful to the baby. Studies just aren't going to probably happen. So we theorize a lot about what could be harmful. Big doses of like salicylic acid could be harmful in theory. So you'd probably want to avoid those chemical peels that are associated with them. Usually the estheticians are very well knowledgeable about what to avoid in terms of that. And obviously talking with your OBGYN too is what they're comfortable with and what they're recommending is making sure that, again, open line of communication is had. But like tretinoin, Tazorac is another kind of retinol you want to be avoiding. I always just tell my patients to keep things nice and simple. Just making sure you're washing your face. Lotions with not a ton of additives. Avoiding some abrasive multi-ingredient products. So keeping it nice and simple.
Yeah, absolutely.
You get the green light to use your vitamin C serum, which is awesome. Niacinamide is something that you can continue using as well. And I think it just, everyone's comfort level is different. So
could you talk a little bit more about the benefit of niacinamide? I feel like, a lot of people may not know kind of the basic benefits that comes with that ingredient.
Yeah.
Especially.
So niacinamide we use a lot often in like acne rosacea patients because it's oftentimes an anti-inflammatory and cooling agent. So sometimes you'll see it in combination with serums, lotions, and potions to help kind of calm down that inflammation.
Amazing. So other than, having really open communication with your OBG, overall of your, primary care providers, do you know of any other resource that people can reach out to kind of figure out what ingredients, what products maybe they should stop using, what they should look out for, anything like that?
There's a couple really good pregnancy apps that have, recommendations on things to avoid. My actually OB has one, which is incredible as a resource. So I could just like quickly scroll and be like, and it had all the foods you couldn't eat as well, which was helpful. So reach out to your OB, see if they have something readily available. Ovia was another wonderful app that I used when I was pregnant to kind of check in and see, is this something I can eat? Is this something I can use on my skin if you're not sure? Obviously, like talking to your said provider about things in moderation are probably okay. Like I think I asked to have like a corn dog at State Fair last year.
As you should.
Not that we're talking about ingestibles versus topicals, what have you, but things in moderation.
Sure. Absolutely. Kind of veering off into more of, treatments, procedures that, pregnant women should not be having. I understand there's a risk that comes with women that get administered anesthesia during the first trimester, just given that crucial development of embryonic development. Could you elaborate a little bit more on, is local anesthesia less risky than general, which I can imagine it is, have like the overall knowledge behind that?
I think kind of party line is you want to avoid things that are elective, I would say, to not put risk on the baby. Probably local lidocaine's probably fine in small amounts. Lidocaine with epinephrine. I know we here oftentimes prefer to do like our surgeries on our melanomas depending on the severity or precancerous moles until like second or third trimester if those can wait. So again, it just kind of depends on the situation, the severity of what procedure you need done and the sense of urgency, I guess. Generally speaking, third trimester is preferred to wait for those things, but sometimes we can't, unfortunately.
Is there any risk that comes with cosmetic injectables treatments?
So obviously back to, again, nobody's going to do a study while a pregnant woman's carrying a baby because, nobody wants to, for one, volunteer for that study. Nobody wants to perform that study. So injectables are not advised or ill-advised during pregnancy. That includes Dysport or Botox, filler as well. In theory, risk probably. Well, we'll redact that.
Yeah, sure, that's fine.
Bottom line is you probably want to be avoiding those procedures. You can wait until after delivery. As much as I missed my Dysport. And was ready.
Ready to get back into it.
I asked Hannah Patterson or Hannah Dahl formerly why she didn't show up at the hospital with Dysport in hand and a Jimmy John's sandwich, but alas,
she's supposed to be your homegirl.
I had to wait. Same thing kind of goes for breastfeeding. They actually did a study that a woman who had full-on botulinum poisoning, the toxin did not cross her breast milk nor affect her baby. Now, again, Is anyone going to impose that risk on their child? Probably not.
Right. Do you have any other last pieces of advice for, any pregnant woman out there who is really adamant, really wants to continue their regular skin routine while they're mid-pregnancy, and possibly just don't have the resource to, find out and kind of figure out what they should and should not be doing?
Kind of back to my party line of keeping things nice and simple. I think obviously every skin's different, and certain skin conditions need prescriptions, but I think we all get too excited. It can be very overwhelming, all the products that are out there, especially with TikTok and Instagram and all the fun advertising we see as consumers. So I think the easiest thing to do is, simplify things, get a good gentle cleanser. Vanicream, CeraVe, Cetaphil are all really good lines. Sometimes active ingredients like BP can be helpful. And then, obviously what's really important is sun protection too.
Yeah, absolutely. And
then talk with your derm provider or OB about, your skin concerns, and just know that it's short-lived. It may seem like it's the longest thing in the entire world.
Yeah.
It certainly does when you hit, week 36 and no end in sight. But ultimately pregnancies end and you can get back to those skin routines afterwards. But it is kind of tricky to sit there and grin and bear it if it's not going your way. So
yeah, I kind of want to veer off more into just your generalized skincare expertise. I'm gonna give you a scenario. All right, just pretend I'm your girl. Pretend I'm your baby girl. I'm a little bit more grown up, but cognitively, like, I'm ready to know a little bit more about skincare. And I say, hey, Mom, if you could give me 3 main tips, just 3 tips on just how to maintain good skincare. What do you think those 3 would
starters, get off the TikToks.
Okay. Mom.
I have so many girls come in, sweet teenage girls who are like wanting to do the drunken elephants, and it costs a bajillion dollars. So that's my number. I'm just kidding. That's my number 1 piece of advice. First, SPF. I know it is boring and it gets ingrained into all of us, but sun protection is going to be the best thing for you. So it's going to prevent those fine lines. It's going to prevent sunspots and ultimately skin cancer, which is really, really, really important.
Absolutely.
Vitamin C serum is kind of the best thing. And then the goat, tretinoin or retin-A or some form of a retinol.
There you go.
Keep things nice and simple.
Anything in particular to advise for like a soon-to-be mom who just wants to get on top of it and wants to really simplify? Do you have kind of any products that you would recommend?
Getting in early to see your derm. I have those conversations all the time with my patients about those that are thinking about trying to conceive or family planning soon. Like, talking to them about what they can and can't be on, I think, is helpful. And then just keeping things nice and simple. I just tell people all you really need to do is, in terms of prescriptions are lovely and wonderful, but wash your face, use your vitamin C serum, use your sunscreen. And then when you're not pregnant, you can use your retinol.
Yeah, go back to it. Get right to it.
Yeah.
I love it.
It'll be there waiting for you.
Awesome. Oh my gosh. So if there are any key takeaways you take away from this podcast today, number 1, stay in open communication with your providers. Let them know of your skincare routines. If you're having troubles figuring out what products to use, make sure you have that open communication and figure that out in a safe manner. Make sure you have the resources available to you, and make sure you know where those resources are for any help trying to figure out and weed out any possible risks to your pregnancy or to you. And then number 3, elective skin treatments. It is always best to be safe than sorry and pose absolutely no risk to your pregnancy. So we advise waiting for any sort of elective skin treatments that you may want to do. Again, Haley, I want to thank you so much for being here today. We appreciate your love and aura all over the clinic. You're absolutely amazing.
Well, you're right back at you, Shiab. Thanks for having me.
Everyone out there, stay curious, stay inspired. I'm your host, Shiab Adams.